Well, hello, everybody, and hello, Stephanie. We have got a guest on today to talk about PCOS, aka polycystic ovary syndrome.
Yeah, yeah.
Yeah, yeah.
I'm talking with a little bit of an accent because we just finished the interview with Sam, the PCOS nutritionist. And I think she's based in Charlotte, so she's got a little bit of a drawl. But we
Yeah.
spoke to her about what PCOS is. We know we have a lot of listeners who've asked about that and how to navigate PCOS symptoms and recommendations to cut carbs and lose weight and how that's kind of the
Talking
going.
about that, not her offering that
Yeah, yeah, no,
recommendation.
we've been talking about how that's the common narrative we hear. And she speaks to that. She's a weight inclusive dietitian aligned with body neutrality and all the things that we love. Her specialty is PCOS. In fact, that is what she does. She has a community for PCOS support.
So her community, which just sounded like an amazing offering, is called Nourish with PCOS Collective. We're going to put the information below. I think she said it was something like $29 a month, which is crazy because it's got a Facebook group where you can connect with other people. She's got a whole archive of like videos and information about PCOS and how to manage it in a weight inclusive, HAES aligned space. So if you have been looking for this, and I feel like some of our listeners will have, we are delighted to show you it's here. So we hope you enjoy this conversation. Well, hi, Sam. Thank you so much for joining us today.
Thank you so much for having me. I am excited to be here.
We're excited to have this conversation because Steph and I we were just saying we get a number of messages from people who would really love us to talk about PCOS, the impact on appetite, food, body image, all this stuff. And it's not something that Steph and I have the expertise to do this. So I am hopefully as excited as the listener to learn a lot today. I've even got a notepad and pen. I don't know why anyone would think we weren't recording this conversation.
Right.
A lot of people have a lot of questions about PCOS because there's such a gap in education. So I'm excited to be here and answer all of your questions.
And we do want to get into the 101 of it. Like, what is PCOS for anyone who is not familiar with that? And also, what are the symptoms of that? What are the misunderstandings about that? What are you seeing with the intersection of PCOS and food and prescriptions for food, how to eat and how to manage body weight and these kinds of things? This is all really relevant to our audience. But before we get into that, we always like to ask our guests to share a little about themselves and maybe how you got to this work and what your experience in this realm is.
Yeah, so I am a registered dietitian. So for those who aren't familiar with that, we go through rigorous education. We have to do a supervised, very lengthy internship. We have to pass boards and maintain a standard of ethics. So completely different from like a nutrition. Anybody can call themselves a nutritionist. So I'm a registered dietitian and I worked in school nutrition for a little while. Then I switched to working inpatient clinical in the hospital. And I really felt called to have my own practice where I could really sit and meet with people one-on-one and spend time with them and help them kind of work through their nutrition obstacles. It was during that time that I really shifted my thoughts and feelings around focusing on weight and weight loss, working with clients. I just saw how that wasn't really helpful, that there didn't seem to be a way that people could really focus on weight loss and keep that weight off. I learned about intuitive eating and health at every size and really embraced a weight inclusive approach to managing health conditions. And it was during that time that I kept seeing clients who had PCOS. And something interesting is, even though PCOS runs in my family, I really didn't know what it was or how nutrition played a role. And, with the weight inclusive piece, things were not really adding up to me because I would get so many referrals for a PCOS patient for weight loss, but the actual goal was something different. So this person's trying to restore their period, please help them lose weight. Or this person was just diagnosed with type 2 diabetes, please help them lose weight so their blood sugar will be lower. When I was sitting and working with that client, the focus was so much on weight instead of the actual objective, like have a regular period, get pregnant, lower blood sugar. And it really kind of reaffirmed how much I love, taking a weight inclusive approach, because we could say like, okay, let's focus on your actual behaviors and the outcome that you're looking for. And like, let's view weight as kind of like this independent factor. We don't really know what's going to happen with it. I just really became passionate about immersing myself into learning everything I could about PCOS, because so many of my clients really felt like PCOS was ruining their life. They felt like their health had been sabotaged. They were really struggling with physical symptoms, which I know we're going to talk about. I committed to learning as much as I could about PCOS because I didn't really understand at the time how much the government is involved in healthcare with legislation, and not just with healthcare, but with specific diseases. PCOS used to only be classified with the NIH as a reproductive disorder. So it wasn't getting funding that it really needed to get better research. And the government played an active role in that. And so I got very involved in PCOS advocacy, which connected me with other PCOS providers and the latest and greatest PCOS research. I was fortunate enough to be able to sit on a panel and give feedback for the latest international guidelines for PCOS. So yeah, I've really just become passionate about this area. And now this is what I specialize in. So that's the only area that I work in when it comes to nutrition.
Wow.
Is it weird that I want to go, thank you?
Yeah.
I just want to say thank you for taking that approach. I've heard from a number of people, they get quite scared of dietitians, especially because it's normally doctors that send people to dietitians. So it can feel very medicalized. And I think that can be quite nerve-wracking for people who struggle with food, especially.
Yeah. And to be completely transparent, a lot of my clients have had negative experiences with dietitians. And I could see why. I mean, we have a very clinical training that positions us to be the expert in nutrition. And I do agree, from the medical nutrition therapy side of things, we are the expert. I mean, I had to take a year-long course just about metabolism. I mean, the science side, that is our expertise, more so than a doctor who doesn't receive a lot of nutrition education in medical school. But as an individual, whoever's listening, you are the expert of your own body. So I feel like with nutrition counseling, we need to blend the two. Like, I'm there to plant seeds and make sure that you have informed consent over, whatever has been prescribed for you nutritionally. But at the end of the day, like, your body best.
I just want to add, if it's any consolation, a lot of my clients have had really bad experiences with therapists as well.
At least we're trying to do better, right?
We're trying.
But also there's a big difference between an expert in nutrition and an expert in weight loss, right? Registered dietitians have become synonymous with, to your point, like, send them to the dietitian to lose weight rather than send them to the dietitian to address the symptoms. And that you've sort of reclaimed that in your own private practice of like looking at what's actually the goal and what's important here, as instead of becoming like a kind of another way of lose weight. And that's the profession now.
Mm-hmm. Yeah, exactly. And in the weight inclusive space, we have a saying that focusing on weight loss is a distraction. And that goes along with exactly what you're saying. I mean, if your goal is to lower your blood sugar, if the outcome you're focusing on is your weight instead of your actual lab values, that is going to be a distraction and probably stand in the way of you figuring out like what's going to work for you. It's really unfortunate that people view dietitians as like the weight loss resource, because nutrition can be a powerful tool in your overall well-being. It's definitely not the only tool. But when I think you view nutrition as like a vessel for weight loss, it becomes something that's probably more harmful than beneficial.
Definitely. And why people are so afraid to even approach nutrition, especially after recovering from disordered eating, because it's become just another word for weight loss pressure. All of that said, though, can we talk about what PCOS is?
Yeah. PCOS stands for polycystic ovary syndrome. It's a hormonal disorder. So when we say hormones, we're talking about your endocrine system in your body, but it's also a metabolic condition and it affects the reproductive system too. PCOS is actually pretty common. It affects up to 20% of people born with a uterus, and some of the symptoms are missing or irregular periods, acne, excessive hair growth, hair loss and hair thinning, especially along like the top hairline. It's the leading cause of anovulatory infertility, but it's also, where we were talking about it's a metabolic condition. It increases your risk for type 2 diabetes, cardiovascular disease, fatty liver disease, endometrial cancer, sleep apnea. It can affect mental health. So, with it affecting your endocrine system, that's going to affect your entire body. So it is something I just want to stress. It's really common, maybe not talked about a lot. And I'm glad that there's more and more awareness around it now.
You mentioned a bit ago that sometimes you'll have people come in who think they have PCOS, or maybe the misdiagnosis of PCOS, which rung a bell for me because I was telling Sarah before you got on the call that I actually have been diagnosed with PCOS, but I haven't really followed up on that because I'm not even quite sure that that diagnosis was accurate. I had a long history since I got my period I was 14 years old when I got my period. It was a bit late and it was irregular from day one. Sometimes months and months would go by before I got my period. I did have like hair growth on my chin or even on my boobs sometimes. And I had some cysts and things, but I also had disordered eating from the time I was 14 years old. When I recovered from my eating disorder at 40, my periods became regular. I get them like clockwork now. I don't have the cysts showing up, at least as far as when I've had the scan done since. So when you said that, I was kind of like, I don't like that's relevant to me, and that I don't even know if I have it or not. I have been diagnosed because it's not like a blood test, right? It's diagnosed by exclusion. And
yes, it's diagnosed by exclusion. And so I think that's what can feel so frustrating as someone who is trying to figure out what's going on with their body. It's not like you're just going to go in and get a lab test and it's like, yes, you have PCOS, or no, you don't. There are 3 pieces of criteria for a PCOS diagnosis, and you only need to meet 2. So one is an irregular or missing cycle. And when I say cycle, I'm really referring to ovulation. The second is having polycystic ovaries on an ultrasound. And there are specific guidelines. I can give you a link to the updated PCOS guidelines, but there are specific amounts of follicles that you would need to have on an ovary for it to qualify for polycystic. They just updated the guidelines last year to where instead of an ultrasound looking at your ovaries, if you have an elevated AMH level, which is a hormone that's kind of given off by having a lot of follicles on your ovaries, that can count as that piece of criteria. So that's something that's new. So you could technically be diagnosed with PCOS without getting an ultrasound now. And then the last piece of criteria is elevated androgens, either with labs or signs and symptoms of elevated androgens. So in your case, hirsutism, which is excessive hair growth, is one of those physical signs and symptoms. And that's actually the primary one that they look for, just because even though PCOS can cause cystic acne, and a lot of times with PCOS, we see that along the jawline, hirsutism is a much better indicator of elevated androgens. And androgens are actually difficult to test. Like your testosterone levels are the most accurate in the morning on the first day of your cycle. So they're not the most reliable. And that's why you can use physical signs and symptoms instead. But when we talk about a diagnosis of exclusion, having thyroid issues can cause irregular periods. Having an issue with your pituitary gland can cause period issues. There's something called Cushing's disease that can cause some signs and symptoms of elevated androgens. So hypothalamic amenorrhea, which is what we see a lot with restricting food or overexercising, that can also cause irregular or missing cycles as well. And I actually think that's a really big gap in healthcare right now, because you can have HA and have completely normal labs. And I think from a healthcare perspective, a lot of times just being conscientious about your diet and exercising, they're just viewed as such positive things. A lot of times in a 20-minute doctor's appointment, nobody's going to delve into like, okay, are you actually restricting foods?
Right.
And I'm sure that you all talk about this. I mean, a lot of times people who have HA feel like they're eating enough. They're just being more like conscientious about their caloric intake, and they're very surprised when they need to eat more. So
Yes.
yeah, it's a very gray area. And there is, for the hirsutism piece, there's actually a numerical scale that physicians use or healthcare providers use to diagnose hirsutism based off of where you have the hair growth and how much it is. So like you could have some facial hair and it may not meet the criteria for actually having hirsutism. And, you know, some of that is related to genetics too. If you have a background to where, like, I'm Middle Eastern, so
half Indian over here.
Yeah.
I feel you.
yeah. So that's something to take into consideration as well. It's called, if anybody wants to look it up, it's called the Fairman-Gallwey score. And it's like a diagram, and it has pictures that kind of shows different body parts and the level of hair growth.
We'll include that in the links below, because as you're talking, and I'm even thinking of clients who have, you know, sort of said to me, you know, my PCOS is acting up. I mean, I'll have like a hair growth on my chin now and then. You know, I'm Italian. So like, and I remember my grandma used to like get that too. And I don't know, you know, she never had PCOS to our knowledge, but I wasn't eating enough. I was over exercising, and I potentially had this genetic background, and I had thyroid issues as a result of not eating enough that looked like PCOS, so much so that a doctor diagnosed it, never once asked about my eating habits and restrictions at all. And my history of an eating disorder never even came up. And so sometimes I wonder if, like, how often is that happening? And how often am I even seeing clients who's come to me saying, I have PCOS. That's why I struggle with food. That's why I struggle with my weight. And I've always had this kind of like, how do we know? How do we know? Like, are there ways that we might look like we have PCOS, but don't necessarily have PCOS, and that might be happening?
Well, I think something important to mention is that you can also have PCOS and hypothalamic amenorrhea, so it may not be one or the other. But yeah, if somebody has no signs and symptoms of elevated androgens, to me, that's always like a little flag goes off in my mind of like, okay, let's make sure this person definitely has PCOS. There is a subset of PCOS that you don't have to have elevated androgens. I mean, when we're talking about the criteria, however, that percentage is a little smaller. So if somebody is super I'm going to use the words health conscious, of like very conscientious about exercise and nutrition to the point where their body may not be getting what it really needs, we want to focus on restoration and increasing calories and decreasing movement to just kind of see what happens after that. So if cycles become regular and no new PCOS related issues pop up, that may be an indicator that like maybe you didn't have PCOS. There is a gray area with the criteria and the symptoms and even the weight piece of things. I mean, people associate PCOS so much with weight, but in reality, that's so subjective. I mean, I've never worked with a client, no matter what their body size was, to where they didn't feel like they had a quote unquote weight issue. And they always attribute that to PCOS. But the reality is PCOS comes in all body sizes. And even, now I'm glad it's documented in the updated guidelines. It specifically states that insulin resistance and inflammation, which are really at the core of PCOS, occur independent of weight.
That's really important.
Can we talk about the challenges of living with PCOS? So I know one thing that it can affect fertility, but let's say I had PCOS and I didn't really know it. And I'm not planning on having children. But one, what might be the advantage of me even investigating and getting a diagnosis? But two, like, how does this interfere with people's health or quality of life? What are the challenges?
That's a really great question, and I appreciate you asking it because I feel like there is so much focus on the fertility side of things. And I know a lot of people with PCOS feel dismissed when they feel like PCOS is impacting their life in other ways. I think one of the biggest ones is fatigue and energy levels. For most people who have PCOS, there's a degree of underlying insulin resistance that can occur. You can have a normal blood sugar and a normal A1C and still have underlying insulin resistance. And if your body's not using carbohydrates efficiently, carbohydrates are our primary first source of fuel. So with insulin resistance, a lot of times we'll see fatigue. There is also an association with elevated androgens and sleep apnea. So some people with PCOS have sleep apnea and they don't even realize it. Also, with the fatigue piece of things, sometimes some of the medications prescribed for PCOS can cause fatigue too. So that goes into the fatigue piece as well. But I would say the fatigue piece also, I think it's just beneficial to know that you have a metabolic condition and that there are increased health risks with PCOS. And it doesn't mean that's something that you need to micromanage or really stress out about. But I think being more proactive about having a good relationship with a healthcare provider that you really trust is important. Getting annual labs done so you know what's normal for you and you can be more proactive if, one time you get a lab that's a lot higher than what it normally is so that you can manage that in whatever way feels best to you.
Yeah, I just want to speak to, I think, people in the UK, because I think in the UK we have a national health care system. They're not going to do annual blood tests just to see where you're at. They're just...
Well, the updated international evidence-based guidelines actually recommend it now.
Okay.
So it's not just I want to know what my labs are, so let me pop into this. There's actually specific recommendations about monitoring blood sugar and monitoring your cardiovascular health. And they might even mention liver labs in there as well. So when I say monitoring labs, I'm not saying every year you're going to go to the doctor and get every single hormone checked, but you should be managing or monitoring blood sugar, a lipid panel, so all of your cholesterol levels and your liver enzymes.
So if these things are a bit high, that's going to really frighten someone with disordered eating, right? How would you speak, I guess, to those people who they want to bring some of these levels down? Maybe they're at risk of binge eating, or maybe they recovered from an eating disorder. I know your approach is weight inclusive and haze aligned. So how do you think about that piece?
Yeah. So in my work with clients, one of the first things that we do is define health individually. And I think a lot of times when people think about health, they think about just having normal labs and no medical conditions. And in reality, that's not realistic for anyone, whether or not you have PCOS. So what does health look like on an emotional level, a mental health level, an overall well-being level, and having a really clear idea of what that looks like, I think would be step one. And if somebody has a history of disordered eating, the way that you would approach nutrition and exercise and medical management is probably going to look a lot different than somebody who doesn't have that background. But I think it's really important to think about your mental health as part of your overall definition of health. And so I have a lot of clients who choose to focus on that instead of the lab piece of PCOS. So it's pretty individual.
So let's say somebody definitively has has a diagnosis of PCOS and has a belief PCOS is creating weight gain in my body, which I know that you just spoke to. And my mental health would be better if I lost weight. And I just want to know like how I should do that, because this whole intuitive eating and anti-diet thing, maybe that applies to everybody else, but I'm up against metabolic issues that make it harder for me to lose weight. The doctors are telling me to cut carbs. How do I reconcile my mental health with the very real symptoms that are creating what I believe to be like the impediment to my mental health, which is weight gain?
Mm-hmm. I would want to dig really deep into the association between weight gain and decreased mental health, like what is going on there on a deeper level. Because everything that we know about weight, it still applies to PCOS. Like there's no research that shows that somebody can intentionally lose, I shouldn't say somebody, for the average person in most cases, intentional weight loss efforts will likely fail. And that doesn't matter, that applies to PCOS and to people who don't have PCOS. So we're talking about a pursuit of something that is going to be very unlikely to happen. And what is that going to look like for you and your PCOS management journey and life with PCOS in the long run if you are pursuing something that is likely not going to either be able to happen or be sustainable? That's really where I would recommend starting the conversation. But also digging deeper of, with your weight and mental health, what's going on there on a deeper level? Is it you need to work on some inner child healing of situations that have happened when you're younger? Is it that you have a healthcare provider who is very weight centric and is providing biased healthcare? And really, we need to work on building out your healthcare team. Is it related to something happening in your personal life or your relationship? And really, there are other issues to address there. Like we always want to dig deeper and really evaluate the why.
So what do you make of the assignment, so to speak, from perhaps biased medical professionals about cut carbs, lose weight? That's how you treat PCOS.
Yeah, it's really frustrating. I'm happy now that as more and newer research comes out in a lot of the PCOS research spaces that I hear part of these conversations is that there is an encouragement to kind of move away from this focus on weight and like prescribing weight loss as like the thing for PCOS. I mean, where that comes from is the idea that with less adiposity or fat on the body, you would see an improvement in inflammation and insulin resistance is kind of like where that comes from. But we really see that to not be the case in practice. Like you can improve insulin resistance and inflammation independent of weight. And we know that these things occur independent of weight. Like we've seen studies of adolescents who have PCOS and insulin resistance occurred at all BMI levels. I feel like it's kind of a moot point to focus on weight just because it's not effective. And, if somebody is wanting to feel better, sleep better, have less fatigue, have better blood sugar, like let's focus on the things we know that can actually help them work towards feeling better versus kind of like staying in this hamster wheel, focusing on weight. The advice to cut carbs. So I will say this, I highly respect physicians, but I know from working in the hospital and having taught like medical lecture series to physicians, I mean, we're told time and time again that they receive very little nutrition training in school. So I would start out by working with a registered dietitian. We really want to focus on things that are sustainable in the long run. And completely eliminating carbohydrates or greatly restricting them is not realistic for most people. It's also not necessary to improve a lot of the physical symptoms of PCOS. And so, to be completely transparent, if somebody had a higher degree of insulin resistance or diabetes and they greatly restricted carbs, they might see their physical symptoms improve. Their period might become more regular. Their acne might get better. They're probably going to feel like crap, and their mental health is going to probably decrease a lot. And those results are probably going to be short-lived because that's so difficult to stick with. And we do see that weight cycling and kind of going through these periods of restriction and then kind of quote unquote falling off of that restriction and then going back to restriction, it makes insulin resistance worse. It makes inflammation worse. It can increase your risk of cardiovascular issues. So I would just view that cycle as something that's not really going to serve you well with PCOS management.
I think the challenge is, though, with the weight cycling is nobody thinks they're weight cycling. So if they're on like, oh, okay, I'm going to lose weight, they're not thinking they're going to lose weight and regain it. They're like, no, this is going to be the time that I do it. And I think sometimes that's hard to see as well when you're in it. And then the other question I wanted to ask were, what are some of the things that people can do to improve something like insulin sensitivity or improve their blood sugars, which isn't about restriction?
Yeah. I totally hear you and experience this as well, is that people don't recognize a period of weight cycling because diet culture has kind of ingrained in us that we are meant to be in a smaller or a thin body. And if we can't restrict enough to get there, then that's a moral issue with us or an issue with our willpower. And we just need to keep trying. When in reality, people exist in all body sizes, whether or not you have PCOS, and your body is probably always going to find its way back to where it's meant to be. And it's not an issue with willpower at all. It's just the fact that we really don't have that much control over our body size, and diet culture is kind of gaslighting us. So in terms of nutrition, eating regularly is a really great place to start. And I know that sounds super basic, but with insulin resistance, we really want to give our body consistent energy and consistent nutrients throughout the day. And so if you are somebody who skips breakfast or skips a meal or saves up and then tends to have a much larger meal where you're so hungry, you're just kind of disconnected from your body, that's probably not going to serve your hormones very well. Also, increasing protein and fat and fiber at meals can be really helpful too. Those are all things that stabilize blood sugar, but you can add those things without restricting or micromanaging your carbohydrates. And I think that's where people get really held up.
I think that's so true. Even my own default brain, like I increased protein so many times because I don't think I had PCOS. But even if I did, I went that route. Also just because of the craze of low carb, high protein eating. And I think it's almost like we have to really stop and think about when you're talking about increasing satiating macronutrients like fat, fiber, protein, that doesn't automatically mean you lower carbohydrates. Like you can increase things and still eat carbohydrates. Like there's a difference. I think we hear increase protein, decrease carbs. Like it just kind of is the unspoken subtitle.
Yeah. And I understand why somebody's mind would go to that place because we receive so much messaging about that. But, I think reflecting on how that's really serving you, especially when it's not really necessary with insulin resistance, especially, so if you're somebody who loves eating cereal for breakfast, instead of saying, what can I replace this with? Just ask yourself, what can I add to this? Or what can I pair with this? Yeah. Is a great place to start.
Have you ever seen any studies on the impact of fasting on people who have PCOS?
This is a very controversial topic in the PCOS space because there's plenty of research on fasting and insulin levels, but a lot of it has been done in men. So we don't really see a lot of the hormonal impact. And it's a common recommendation to fast. A lot of my clients, physicians have told them that. But a general consensus is just that because with PCOS, the risk of disordered eating is so much higher, eating regularly and focusing on nourishing yourself is probably going to serve you better in the long run.
Is there anything non-food related that can help with insulin resistance or blood sugar levels?
Yeah, so many things impact blood sugar. Stress, the way you move your body, sleep is very important. So basically, like any sort of lifestyle factor is going to play a role in insulin resistance. And I think there's so much focus on nutrition that we forget about that. But if you're somebody who, maybe even just thinking about nutrition is not going to be great for your mental health, focusing on your overall well-being and how much sleep you're getting, or are you doing anything that's impacting your sleep, like drinking alcohol before bed or something like that. Those can be great things to be mindful of. Stress does play a really big role on insulin resistance. And for my clients who have type 2 diabetes and are monitoring blood sugar, obviously under the direction of their doctor, we really see this. I mean, I've had a client who their blood sugar was much higher during the week because they had a stressful job. And on the weekend, their blood sugar was much lower. So I think if you have stress in your life that can be managed, or if you have any coping mechanisms or techniques to bring your stress levels down, that can be really helpful for insulin resistance as well.
So I have hypopituitarism. I've got a tumor in my pituitary gland. So I'm on a range of hormone replacements, and hormonal fatigue, I am very familiar with. So I'm curious if you have any tips, because this overlaps with PCOS as well, for dealing with fatigue that's caused hormonally. Sometimes we have fatigue because we're just run off our feet or stressed. But for that kind of hormonal fatigue, I know it's definitely changed my preference for sweet things and that desire to want to draw energy in through food. Yet that's something I've had to do a lot of work on in my own disordered eating recovery.
Yeah, that is tough. I'm so sorry that you're dealing with that. I think a lot for PCOS specifically is just kind of pinpointing exactly where that fatigue is coming from. So getting labs done to rule out nutrient deficiencies, getting screened for sleep apnea, having an understanding of your degree of insulin resistance and how that's playing a role, really understanding kind of where that fatigue is coming from so that you can address it can be a great starting point. And I think you can also observe your body without judgment. So just giving yourself space to get to know your body. So on the days when you feel especially fatigued, do you have more cravings or are you hungrier? And just getting an idea of the way your body is responding to your fatigue can be helpful.
And I would just add, for anyone listening who relates, I think one thing that really helped me was to really honor the fatigue, in as much as sometimes I could feel fatigued. And if I pushed myself a little bit and got the energy going, energy would start to come. And sometimes it just wouldn't. And so really having permission to go, okay, I'm willing to push myself just a little bit, just getting up and doing something. But if I feel that fatigue pushing back against me, I'm going to respect that and not beat myself up over it. And sometimes I might have felt fatigued and not pushed myself. So I didn't even know if I could have pushed through it, and kind of having a bit of grace with myself for that, not always having to get that analysis right, if anybody listening relates to this kind of fatigue.
Yeah, definitely. And I think with PCOS too, and inside of my membership, I have two different resources. One is a masterclass called PCOS 101, and one is a masterclass just on fatigue. I go through the steps on addressing fatigue with PCOS because I think this is really where understanding what's going on with your body and where your symptoms are coming from can be really helpful, because if you have fatigue from sleep apnea, there's probably going to be very little that you can do to help that fatigue outside of addressing the sleep apnea. Whereas if your fatigue is coming solely from insulin resistance, maybe moving your body might actually be really refreshing. It's kind of having some tools to help you connect the dots and having a healthcare team that can really help you and be gentle and help you consider your mental health and your history with getting labs done, or, any sort of experience that might be triggering or distressing to you, and being really gentle with that.
Can I just say, I love the way you said that. You said moving your body could be really refreshing. I was like, that's such a refreshing way to hear that said.
Yeah. And, I think at the end of the day, like, your body best, but a lot of times we're not given the space to explore that.
Mm-hmm.
And so I think that's really important with PCOS and symptoms, is giving yourself the space to just observe what happens without judgment, and try new things and see what happens, and practice, self-compassion in the process.
And space sounds like something you're offering in your membership.
Yeah, I feel like this conversation is a great idea of kind of what it's like to work with me. But inside of my membership, I really try to just give you the information without judgment. And you can take, whatever you need from that. In our community, every week, we do a check-in where we talk about like goals or intentions for the week, but they're centered around self-care. And so one thing that we stress is that's going to look different for everyone. For one person, that may look like creating boundaries to decrease stress levels. And for somebody else, that may mean working on sleep. And I think that's what's cool about being in a community that is weight inclusive. You're observing everybody else, giving themselves permission to have space.
So anyone listening to this, if you're trying to figure this stuff out for yourself, to be part of a community, Steph and I are massive on community, where you can connect with other people who are coming at this from a similar angle. I think there's so much we can learn about ourselves just through seeing what other people are doing as well, and how other people are thinking about it too. So we will make sure those details are definitely in the show notes, and you offer it at an incredibly reasonable price, Sam. And I really hope people who need it take advantage of it.
Yeah, this has been something I've wanted to do for a really long time. I love working with clients individually, but there's something powerful about having a resource that's not, I know healthcare can be so expensive. So my goal with this membership was to try to provide something at a lower price point where people could kind of take what they want and leave what they don't need, but also have that power of community. And we have monthly calls with me and master classes. So there are lots of different opportunities for learning about yourself, depending on, how you like to learn.
Well, thank you so much, Sam, for coming on and for sharing all your knowledge with us. And we'll put all the information below with how people can reach out to you, follow you, or join your community, or send you a message. So thanks a lot.
Thank you so much for having me.
Thanks, Sam.